Hello, you wonderful bunch. I hope you're well. It's great to see so many of you in chat already. I hope you're all good, guys. I'm a bit under the weather today, so apologies if I look a little bit flushed. I don't know why my camera's mirrored. My camera isn't normally mirrored, but I'll try and fix that. If not, you'll just have to deal with it. That's fine. Anyone that was with us on Twitch last night will know that cameras has been a bit of a theme lately. I've done my first ever TikTok live at the grand old age of 40. And it went great. Hang on, let's fix that. There we go. Look, as if by magic. I'm some sort of professional these days. Yeah, at grand old age of 40, I done my first TikTok live, and then we went to go live on Twitch, and the camera wasn't working. So we don't panic about this stuff now. We kind of roll with the punches. But yeah, I'm a little bit under the weather, guys. It's a bit touch and go this one tonight. So sorry if I look a bit flushed and clammy. You can just deal with it. To be honest, it's not a pretty picture on the best of nights, is it? So you know what you're getting by this point. But welcome in everyone to the Chronic Pain Club. If you're here for the first time, welcome in. Ultimately, we've been on a bit of a journey, but we initially started as a peer support group that wanted to share lived experiences. There's only so many times I can share my story. I'm very aware that I'm lucky that I get the opportunity to go around and share my story. So I wanted to create a platform for other people to share theirs, and that's how this was all born. And it also provides episodes to the podcast and all this sort of stuff. But we're very fortunate now that we're in a position where we can include people from all sides of the table, from academics, researchers, clinicians, experts, leaders of patient organisations, etc. Everyone's been on here, so it's amazing. And tonight is no different. I'm super excited about talking to tonight's guest. So thank you for joining us. Great to see so many of you. Welcome in, Amy, Si. I'll try. I normally go down and say hello to everyone personally, but this gets harder and harder as we grow. So let me get my chat up and go from the top. Oz, welcome in, Oz. Nia, great to see you. Lauren, good to see you. Cinny. I hope you're doing well, Cinny. Sorry, no worries about the lurking, guys. For anyone who's not familiar with that term, it's like a streaming term where people watch but they don't interact in chat. That's totally fine. You are the backbone of our streams and our community. So anyone that's just watching us in the background, thank you so much. Don't feel like you have to get involved in chat if you're not feeling it. We're all well aware that everyone's got stuff they're dealing with. But I hope you're good, Si. Great to see you. We've got people. Where's everyone watching from? So we've got Northern Ireland, we've got the US, we've got London, Norwich. Welcome in, Amy. I hope you're good. Welcome in, Big Drizzle. Have we seen you on YouTube before, Big Drizzle? I don't think we have. If this is your first time here, thank you so much. And if this is not, feel free to berate me for forgetting that you've been here before. But I think I know you from Twitch, but I don't think we've seen you on YouTube. So welcome in. And anyone, guys, who follows us around on different platforms, I really appreciate it, because I get bored of the sound of my own voice. So I don't know how you guys tolerate being with us on Twitch, where we play computer games for distraction and escapism, and to help people get through their days a little easier with whatever that they're dealing with, whether that's chronic illness or just what life throws at them. And then obviously we do the serious stuff here, where we share experiences and try to raise awareness and reduce stigma by talking about those experiences. And yeah, so thank you. Really appreciate it, guys. Really appreciate it. Have I got any admin to tell you? I think I have. Let me remind myself. That's such as my poor planning tonight. So yeah, we're taking a bit of a break. This is the only or the last Chronic Pain Club in April. So sorry to share that. But I'm away in Prague week after next for my first sort of trip for Rheumatic Disease UK, which is great, but it means I ain't going to be here for a couple of Sundays, and obviously I have to make sure I make time for family around those trips as well. They sacrifice an awful lot for me to do these things. Like just now, right now, my other half is putting Dylan to bed, dealing with the dog, tidying up after dinner and everything else, and moderating the chat. So shout out to Nia Cheeks and Lauren, who are two moderators in chat on YouTube. Really appreciate it. And Nia also picks up on Facebook and other places. And yeah, none of this stuff would be possible. So when I go away, there also has to be a bit of family time factored into that. So yeah, this will be our last Chronic Pain Club in April, guys. But there'll be lots of clips and stuff coming out on the YouTube channel. And then we will be back on the 4th of May with ASIF or ASIV, the international sort of body for axial SpA. And we'll be talking about is it Walk Your Ass Off? I think the AS Communities event is in the first weekend of May. So I'll be looking forward to bringing you that. I haven't thought that far ahead, but they joined us last year and it was a really popular episode. So I look forward to that. And I should just very quickly say before we bring our guest in, a big thank you to our channel members. We get no sponsorship for any of this. All the pretty lights, the fancy microphones, everything is paid for out of our own pockets. We've never been sponsored. We've never had industry support. We've never done product placement. We never will do product placement. And if you want to clip that and come back to me 2 years time, if I'm ever in a position where I'm trying to sell some sort of bloody cream or cure, you just know I wouldn't, but we wouldn't do that. But we've never had any sponsorship or anything for this show. So the only thing that supports us is the tiny pennies we get from YouTube ads and the following people: Saduki, Lauren G, Kevin G, another Saduki. I keep reminding them they're signed up twice, but maybe they're happy about that. What a legend Sarah is. And Simon, guys, thank you for all your support. Simon in particular, who has been a member for 22 months. I'm pretty sure since the first month we could have members on this channel. Simon has been a member. So thank you guys. It might only be a couple of pounds a month to you guys, but it means the world to us and helps us keep the lights on, so to speak. So I really appreciate it, guys. And if you want to know more about that, if I was professional, I'd have a link for this sort of thing, wouldn't I? So how about that? There we go. Look, I got the point wrong. It should have been there, but it was fairly slick until I pointed it out, and then it wasn't slick. So if you want to know more about how you can support the channel on YouTube, there's a QR code there, or you should see under this stream something that says become a member or join. I think it might say join. But yeah, that's where you can find out more about that. Right, that's enough of me talking for tonight. I'm going to look forward to settling in and listening and learning with our guests. Let me kill the music, guys. The usual thing. I'm sorry for the regulars who have to hear this every week, but we obviously have lots of new people join us week in, week out on the show. We will take chat off the screen now, because that not only keeps our guests safe and everything, but it stops somebody coming in and ruining a video with a comment or some spam on screen. But you can absolutely carry on chatting to whoever you are watching this with. So if you're on YouTube, keep talking on YouTube. You'll see each other's comments. I'll feature the best ones. If you're watching somewhere else, like a Facebook, a LinkedIn, wherever, you'll be able to chat on there too. I will be able to see it. I'll be able to share the best ones on screen, but only those people on those platforms will be able to see it. So if you want to get involved with the peer support community that we have here around this channel, head over to YouTube, find all these lovely people that are chatting here, and they will continue to chat. It doesn't have to be about what we're talking about tonight. If it is, brilliant, and like I say, we'll feature some of the best ones. But we're a peer support community. If you want to just talk about your day, your week, what you're not looking forward to tomorrow, Monday, all that's absolutely fine. Get involved. And that's what we're here for. You're not being rude. You're not doing our guests a disservice. Lean on each other. That's what we exist for. So without further ado, because I feel like I've rabbited on for far too long tonight. We are absolutely honoured tonight to be joined by Dr Mrinalini Dey, or Minnie, I think I'm allowed to use during the interview, who is a clinical research fellow and rheumatology registrar at the Centre for Rheumatic Diseases, King's College London. Minnie, welcome in. I hope you're well.
Thank you for having me. Very exciting to be here.
Thank you. We're very excited as well. So like we've shared a lot of lived experiences over the years, and every now and then we're fortunate enough to get somebody like yourself come and share from like a professional background. So yeah, really looking forward to this one. I know you wear lots of hats and have lots of titles and things like that. So I mentioned a couple there in the introduction, but I wanted to give you a few minutes to basically tell us a little bit about what you do, and feel free to go into a bit of detail as well about maybe what they entail as well.
Yeah, sure. So yeah, thank you for having me. I've been following this channel and your work, Joel, for quite some time now, and it's a real honor to be invited on to talk about the things that I'm passionate about, which I'm sure we'll be talking about later on. So yeah, my name's Mrinalini Minnie. I'm a rheumatology registrar, so I'm at the senior end of my training and preparing to become a consultant in rheumatology. But currently, I'm taking a little bit of time out of my training to do a PhD, some research in social determinants of health and how they impact people with mainly inflammatory arthritis, but rheumatic diseases in general. And recently, over the last year or so, I've been focusing on health literacy in particular, which is what we're going to be talking mainly about today. In addition to that, I am very privileged to be involved in quite a lot of activities with EULAR, so the European Associations of Rheumatology. And in particular, I'm the Young Rheumatologist, or EMUNET, representative to the PARE, Patients with Arthritis and Rheumatism in Europe committee. And I've had a few different roles in EULAR, such as being like the social media editor for EMUNET, the Young Rheumatologists, done some work with EULAR TV. That's really where I first started in sort of in front of a camera. I think it was pre-pandemic. So yeah, that was, I think the first time I did that was 2019. But yeah, I have to say the work I do with PARE is probably the most fun and the most learning that I've had from working with EULAR. I just love it. And I think we'll touch on this later, but it's a really nice learning experience, and just really great to be in the minority around a table when you're sitting in those committee meetings, and just sitting there as a clinician and just learning from what people have to say about living with the diseases that you've learnt about at medical school, and now you have the privilege to treat in your clinic. And I just think that's great. And they're a great bunch of people too. So it's really nice.
That's demonstrated by how many of them have been willing to come on here or on the podcast as well. So we had Dr. Simon Stones not that long ago, and last year I was at EULAR doing the podcast, and so many willing volunteers. Like, that was terrifying, pitching up there as a patient with a microphone, but so many people. And when you asked them why they were here, it was because they were involved with PARE or some sort of subcommittee or something. So massive shout out to everybody involved with those with that work with EULAR, because it really does come across. So thank you.
So those are really the main hats that I wear. I'm sure I have forgotten a few things, but I would say those are the main things and the most relevant things.
And you've come up on my radar so many times, whether that, well, I'm not on Twitter or X now, but when I was through there and LinkedIn and everything, like the amount of times it felt like we kind of crossed over, and I was seeing something you'd posted or work you were doing. So you're clearly very busy. So thank you for finding the time to sort of give up a little bit of time on your Sunday to join us.
Absolutely, yeah.
So we're going to be talking about health literacy and kind of why it matters, and we'll do a real deep dive on that. But what I thought is, just in case anybody's watching this either live or watching it back, etc., for anyone that maybe isn't familiar with that term, before we jump into that, do you want to maybe give us a bit of an overview explanation about what we mean by that before we start talking about it?
Yeah, sure. So health literacy, I think even if you asked many members of the medical body, I think many people have a poor understanding of what health literacy actually is. So the definition of it from the World Health Organization is that it's the ability to access, understand, and then use information in ways that promote and maintain good health, not just for oneself, but also for families and communities. So it goes beyond, it sort of transcends beyond simply being able to read a leaflet or read food labels. For example, it actually encompasses many different facets and domains. So yeah, that's really the crux of it, as it were.
Brilliant. I love how you could just rattle that off, because I think I'd have done a lot of and ah and trying to explain that. So thank you. I really appreciate it. So I suppose before we get into that and how it benefits both patients and clinicians and everybody sort of involved, what got you into that? Like, how did that start? Because I feel like there must be, you're so passionate about that subject, which I'm sure everyone will hear shortly. There must be a story there or something that
absolutely. So I should give a shout out to my wonderful PhD supervisor, Dr. Eleanor Nikiforu. So I've been working with her now for over 5 years, and essentially she sort of introduced me to the concept of health literacy, but also research into social determinants of health in general. And I really think that I've always wanted to do academic medicine and research in rheumatology. I think the first time I really came across this concept was actually as a medical student, and the things that got me into rheumatology in the first place. I was working in Adam Brooks Hospital with the vasculitis team there. And I was doing a little project on patients' understanding about the side effects of their biologics. And it really struck me how, patients have been given a leaflet, and then doctors have assumed that the patients have read the leaflet, and then they assume that patients are going to be aware of what the side effects are and that they should, stop the drug when they've got an infection, for example, or do this or that or the other, and this is how you take it. And actually, when you speak to people and ask them, okay, did you know this? Did you know that? No. But in the notes, it says they've been given a leaflet and they've been told this and told that. And I think that's when it first kind of hit home to me. So that was like sort of going back almost over 10 years now. And then more recently, I've been doing some work on comorbidities and social determinants of health. And just prior to my PhD, I was involved in a bit of qualitative work where we interviewed just over 40 people in our local sort of diverse area that I work in, looking at the sort of barriers and the facilitators of good health for people with rheumatoid arthritis in particular. And several aspects came out in that that we wouldn't normally be able to sort of tease out from, say, doing big data work where a lot of this work is done, or even just talking to a small group of people. And one of the things that came out again was health literacy and that aspect almost of shared decision making. So that collaborative working between a clinician and a patient and working together to formulate a management plan. And that's when I thought, I'm going to focus on this, because the other aspect, the more I looked into it, was that Public Health England, as it's no longer called that, I think it's called something else now, but they did a report on this almost 10 years ago, and a whole report into health literacy. But then if you actually look, there's been no policy or anything that's come out of that. So it's a really important social determinant of health that's having a massive impact on people's lives, people's well-being, not just in rheumatic diseases, but in chronic diseases in general. And that's been identified by the World Health Organization. But I couldn't personally see that anyone was doing any sort of work around it, particularly in the UK. And so I thought, I'm going to look into this and try and delve a bit deeper into it. Yeah,
I love that. In fact, because you mentioned biologics, and they're so relevant to me as somebody who's been on it for a long time. I was so far into that journey before, like, just to give an example, and people still don't realize this one is a factor for a lot of people on them, and it can like mask a fever, or it can, lower temperature. So the amount of times I'd have every symptom of a fever. I'm shaking, I've got the sweats, and I'm wrapped up like flu-like thing. And then I'd do my temperature and it's just nothing. There's like 36 something. And then I'd be well, and it'd be really low, temperature. And only to ring up my doctor to find out that, or, biologics team. Oh no, that's a common thing. You were given a card, I was given a card in my 20s. I'm 40 now. I can't remember what was on that little business card, and it was in red writing. Yeah, but you just can't remember. So I suppose that my sort of impression with health literacy as well is that it's got to be like a continuous thing, hasn't it?
Yes.
It's no good at just being at the point of service and then that's it. And I don't know about other people on biologics. Maybe anyone watching this live can get involved in the chat or share in the comments. It's like, you get a lot of support and education when you first go on these things, but nobody really checks in later or asks if you need a refresher or when your life journey with your condition and your medicine changes. Like, I wasn't a parent then, I am now, and maybe that changes things. So I don't know what your view is on that being a continuous thing.
No, absolutely. And you mentioned becoming a parent there, and the project that I mentioned that I did as a medical student was actually specifically on pregnancy side effects. I didn't say that, but that's what it was on. Okay. And it's a very real thing, and people's lives change. Life events happen, and as you say, I think we're pretty bad at sort of checking in and just checking. Actually, have you had an infection recently? Did you know you were meant to stop that drug? Yeah, so I think that it is important to keep checking in about health literacy and other social determinants of health, which can also change. There is increasing evidence coming out now that health literacy is modifiable. So that sort of work I'm planning on doing post PhD, just to see if we can develop interventions, and there have been interventions that have been suggested by World Health Organization. Again, there's something called the Ophelia Project, which is a form of communication and a tool to help clinicians to assess people's health literacy and then try adapting their communication methods according to individual need with the patient they have in front of them. So yeah, absolutely. I think what it all boils down to, and what I hear from my colleagues and I see myself, is time. And patients will recognize this as well. You know, you always feel so rushed, and particularly when, you know, clinics are running behind, you don't feel like you want to, from the patient point of view, I've been there myself, you don't want to feel like a burden and ask those questions. And so, yeah, time is a big factor, but we need to find ways in which we can efficiently but effectively address this important issue, essentially.
And maybe I'm jumping ahead a few steps here, but because we always cover it on this show in terms of the caregiver as well, making sure that they're a part of that conversation as well, you know, and obviously people's caregivers change through time. So a bit like we mentioned, your life journey with your condition and your medicines change, your caregivers change, you know. So maybe it was close family, then it becomes a partner, then it becomes friends, or whoever that looks like. So it's making sure that we're widening we're zooming out from the patient to make sure that we can help other people around them have that information and support them as well, right?
Yeah, absolutely. The role of the caregiver is so important. And actually, I forgot to mention that when I was just talking with the last answer just there, that you know, we forget that actually when you give a big diagnosis like that of a rheumatic disease, or you're starting someone on a complex medication, people, you know, they're in shock. They're in a state of shock when they hear these things, and so they're not taking in half of what we're saying. And I think we sometimes forget that. And so, you know, I know that many people now, including myself, we ask, you know, is there someone sitting outside in the waiting room? Do you want to bring them in, or do you want to get someone on the phone, so that there's two sets of ears listening to this rather than just one? And that in itself is a way of like trying to enhance that health literacy as well. So yeah, the role of the caregiver is vital. Yeah.
And obviously I can sit here and think of like 10, maybe 20 reasons why health literacy matters from a patient point of view, and the benefits of that, and why that would improve things. But could you give any examples from like the clinical side where maybe, you know, that partnership, if the patient is more informed, better educated, where that would actually benefit them as well?
Yeah, absolutely. So I mean, the research that I've been doing, which if anyone on the call is going to be going to EULAR, I'll be presenting that in the public health session. But just to go back to the patient side, we did find in a national cohort, so we assessed health literacy in about 1,000 people, and it's found sort of aspects, sort of worse disease activity, more flares, impact on work, and decreased likelihood of being on a biologic medication as well. And when that happens, obviously it then has an impact on the health professional team as well, because, you know, this is something which we can address and we can potentially change as well. And so without going through kind of seeing, oh, well, do we need to change someone's medication? Actually, do we just need to have a better way of ensuring that they understand what the medication entails? And we don't just see it with biologics, but I think I saw it during, you know, the pandemic as well. Like, do people understand the pros and cons of vaccination? That was another one. I've read about, you know, looking outside rheumatic diseases. I've read about cases of people where they didn't understand how to take an inhaler. So they were spraying it on the wrong part, you know, instead of, incorrectly. And so there's many different ways in which both parties can benefit if we just looked at health literacy a little bit better. Yeah.
And I think the thing I found as well, particularly with what we all went through, anyone with a sort of health condition with the pandemic and everything, is, I don't know, as somebody that's had a chronic illness from a young age, you're so used to there's someone picking it up, there's someone dealing with it, and then suddenly you're an adult and the world changes and there was no one picking it up, you know. So for example, I had 6 or 7 infections in the space of 6 months. Like, clearly something was wrong there. And I just assumed that would be getting back to my rheumatologist through my GP. Never, nothing. And turned out I was like neutropenic, and there was this whole big thing, and I had to sort of come off some other things that I took alongside biologics. But it probably took me 6 months of being really unwell, and probably at times a little bit dangerously unwell, where I think as a patient, you're so used to, I don't know, because I respect my medical team, I assume the system's going to work. And obviously, these are all things that are under a lot of strain at the moment. So that example really like shocked me, where like I didn't know what I was supposed to be doing. I didn't know who I was supposed to be reaching out and asking for help for. And I suppose that's just another example, isn't it, where something like health literacy fills the gap.
Yeah, exactly. I think we make a lot of assumptions that, they're doing okay. I've not heard from them. Yeah. It's fine. And we sometimes forget, as I said before, that people don't want to feel like a burden. Sometimes they don't want to reach out. Sometimes they don't know how to reach out. Obviously, there's aspects such as language and access to things like internet. So, for example, in a bit of work we did, we looked at some papers that had looked at aspects such as telehealth and like remote consultations. And actually, people with lower health literacy, they struggle to engage with those forms of communication. So I can only imagine like some switching suddenly to these forms of communication that we never had before, or just switching off all the lines of communication would have been extremely difficult. As an example, I mean, I was a relatively new registrar during the pandemic, and I do remember being asked to do a telephone clinic for scleroderma. And I'd barely seen scleroderma patients. I'd seen a few, but this was really my first proper clinic. And I'm having to ask people over the phone, well, how does your skin feel today? How does your joints feel today? Is your breathing okay? And you, as the clinician, I felt really disempowered. So I can only imagine what the patient felt like. And that's where it's more than obviously just health literacy there, but it's making sure, okay, clearly I'm going to need a video consultation there, but how can I improve the access for that person so that they can use video consultation? Or how can I bring this person, how can I identify when a person needs to be seen face to face as well? And I think all of these questions then rapidly had to be answered. And I think we're still working through them, and we've learned a lot from that period of time. But yeah, I think that really did bring health literacy and similar subjects to the forefront because of the way things had to change then.
Yeah, that reassures me, because I remember like 5 years ago, I maybe it says more about me and I need to maybe get a hobby, but I was like up at night really stressing about the wave of like apps and things we were seeing and how they were supposed to be this replacement. Like, and my argument was, well, it needs to be a two-way thing, So I was getting told I need to fill in this symptom tracker, and if I don't engage, then it'll be assumed that I'm not engaged in my health and therefore I won't get appointments. And none of that came to fruition, thankfully, but that was the sort of conversations that were happening. And as an advocate, I was freaking out about this, thinking, well, what about if you're the 55-year-old divorcee living on your own, you've got no one around you to recognize red flags, etc., and you're suddenly given an app that you've got to fill in and told that if you don't stick to it, and like for me, when I'm well, I don't want to think about being ill. That's always been my thing. When I'm well, I just want to crack on. And these things were like always like a daily reminder that I had to do to say, okay, this is what it is out of 10. And it's all subjective anyway. But I think that for me, again, was another really good example I can think of, where if there had been a bit of a two-way conversation around it, and, a bit of understanding from all parties about how these tools can help, but they can also hinder and things like that, then yeah, sorry, I just picked that example off the top of my head, but I think it's a good one.
And I think that's a really key point, actually, because one thing I didn't say when I was talking about health literacy before is that what we do know is that over 60% of people in the UK, they struggle to understand health information, particularly when it involves statistics and numbers. And again, we just sort of assume that everyone is understanding all of these numbers and these little boxes and things that we're asking them to fill out. And it's not, health literacy is not equal to education either. And so, you could have a very good degree in history or like, maths or something, but it doesn't mean that we shouldn't be assuming that everyone is health literate. And we really should be doing more to like help them, and not simply just, you know, here's a questionnaire, fill it out kind of thing. No, like going through and actually explaining, and as I said before, assessing where that person's at and what their other aspects, like, you know, where are they at into the mental health, and their, you know, do they have capacity to take on this extra information that I'm now about to give them?
Yeah.
Yeah, and I think that particularly the mental health side was quite important during COVID as well. So yeah, really important point.
Yeah, it comes back as that whole being a bit of a partnership thing again, doesn't it? Because
Absolutely,
like
yeah.
I'm the most understanding, like almost like typical British person, where I'll be like, oh, someone else can go first. There's someone more important. So I'm that one who's more likely to say, oh, maybe I don't need help. Like a good example, I recently had a text message. I've been on a waiting list to see a foot specialist for 6 months, and it says you've been on a waiting list for quite a while. Can you reply to this message to let us know you still want to be seen? And even I, for a split second, was like, can I get by? Is it all right? It's been 6 months. I'm like, you know, so you get that. So I think when you get people like me that's always think there's someone worse, you need to, when you're doing these things as well, explain the benefit, the end goal, what's the point of that, you know. So when I'm getting asked to do pain scores or some of the scoring systems that come with psoriasis and things like that, if you don't understand what the goal is, what it achieves, how it helps my care in the long run, and why we have to do these things, trying to get people to engage with that is a hard sell when they just want someone to take their pain away or fix their issue or whatever that looks like.
Absolutely. And I think that comes to the related point of shared decision making. If anyone's going to be at ACR this year, then I'm going to be doing a talk on this during one of the ARP sessions. But just briefly, shared decision making, it just comes back around to the same sort of concept as health. It's a related concept to health literacy, and it is that feeling like it's a collaborative partnership with your clinician, about how you have, you know, reached a decision that this is how we're going to say manage your pain, as you say. But also, you know, at that time, you sometimes you want someone to make a decision, but you want to know that you have also felt heard in that moment. And I think that is the key thing there.
Yeah, it really is. One thing I wanted to dive into, if you can sort of add anything to it, because we do live in a world where like access and reliable information is really hard. Like I'm trying to say that without cursing, because it's really, really hard in the world of Instagram and influencers and product placement and all this sort of thing. Like, so in this space, how do we, you got any advice, I suppose, or any views on how we go about access and reliable information in the world we find ourselves in?
Yes, for sure. So I read quite a stark statistic from the World Health Organization recently that said that health misinformation is 70% more likely to be sort of reposted on the main social media platforms than actual correct information, which is a little bit frightening for both patients and clinicians. And yeah, we're living in an increasingly noisy world when it comes to health information. So there's a few different things that people can look out for. First of all, obviously, podcasts and videos such as this one, and recognized charities, they are the go-to places, I would say, for health information related to the condition which is relevant to you. Ways in which you can identify whether an influencer, for example, or someone you see making a video on YouTube or TikTok is reliable, is there's a few programs that have come up now. So first of all, there is the PIFTIC, so the Patient Information Forum. It's a greenish bluish kind of logo, quite striking, and many charities, I think, did I see yesterday Versus Arthritis have got a PIFTIC now? May need to check that.
I know it's getting more and more prominent. Across charities I work with.
So there's quite a few ones that have got PIFTICs now, and actually individuals can apply to be PIFTICed as well. So that's one way. Then there is the World Health Organization FIDES program. So if you do see an influencer on TikTok or Instagram, for example, they are encouraged to put the WHO FIDES tag on any videos they create. So I do this myself.
Right.
If I do put up a health video, I will tag them. And that is something that you have to apply for. And then World Health Organization will approve you after looking at your content, basically. So that's another thing that you can look out for, which is more of a global program.
I wasn't aware of that one at all. So thank you. I'll try and dig that up and put a link for people watching this back.
Yeah, no, they've got WHO has got quite a big section on their website about just the FIDES program, but also health misinformation and disinformation in general, and how best to identify. And so, yeah, and another thing that they mention as well is like, can you trace back the source? So if someone, again, a doctor or a health professional that you've never seen speaking before pops up on your feed on TikTok, do they cite a source? Do they tell you, okay, it was this paper, or it was this charity's website, or it was this talk that I went to at a conference where I heard this X, Y, or Z? And whereas, like, if there's no kind of source and it's just kind of opinion based, then perhaps, I'm not saying it's wrong, but perhaps being a bit more cautious. Yeah, those are my top tips.
No, they're brilliant, and I will go and dig out those links, because I was aware of the TikTok one, but not the WHO one. So I will look into that, and if some of those things can support you as an individual, because that's always been that minefield for me, and it's something I've spoke to lots of organisations about, because one of the things I saw anyway that happened since the pandemic is lots of people utilised individuals to raise awareness and reduce stigma, and that's all great work. But the challenge is when people are using labels like they are an ambassador for this organization or a representative of that organization, then my argument is that everything on their feed should also
100%.
abide by the rules of that label that they carry, and that has always been a big grey area, and something that, because obviously I'm from the psoriasis disease area, so it's a minefield, absolute minefield of miracle cures and false hopes and everything else. And so yeah, it's a really difficult one. So if there are things out there to sort of almost fact check from an individual point of view, I'll look into that and promote that, because I think that would help a lot.
Yes, no, absolutely. Yeah.
Brilliant. And obviously, like you've mentioned, things like EULAR and that, from like the clinical professional point of view, like how is health literacy, and obviously there's a bit more checks and balances done on the information being shared. There, you'd like to think there's not so much of an issue with that bit, but in terms of health literacy and that, like, is that changing? Like, I'm looking for hope here. I mean, is that changing? Are you seeing that topic coming up more and more?
So I think the first thing to say is that I did not mention EULAR just now, which I absolutely should have done. They are a repository of great information. So yeah, apologies, EULAR, for that. And they do some great webinars as well, actually, for the PARE community, which are always very helpful. So definitely check those out. Health literacy is definitely gaining traction. So at both EULAR and ACR this year for 2025, there are dedicated health literacy sessions. And I think that's a real push forward in the correct direction. I think social determinants of health in general are getting much more airtime in the rheumatology world, which I think can only be a positive thing. I think it's good that we are now recognizing that ultimately our management and care needs to be tailored to an individual's circumstances. You can't just put everybody under the umbrella of rheumatoid arthritis or whatever. Everybody's an individual person, and I think it's good that that's being recognised increasingly from a sort of a social and a socioeconomic point of view. Obviously, there is people like myself and Dr. Nikki Forrow, my supervisor, doing research into health literacy, and there are, we have collaborators around the world who are helping us with that work. And from what I see, it is gaining traction, and it's gaining recognition, at least in the rheumatology world. So there is a recognition that then more needs to be done, but it would be really nice one day to be able to see that being put into policy and in sort of bricks and mortar form. And that's really what, it won't happen tomorrow and overnight, but I'm hoping that that's what will happen eventually.
Yeah, and obviously with people that you keep banging the drum and doing all the great work that you're doing and raising awareness, and I say being willing to come on things like this, because we're pretty insignificant, but it reaches patients, and it helps people get that view that, you know, they are being considered. What matters to them is being picked up somewhere and pushed further on. And like I say, it's reassuring for me because as someone who goes to EULAR regularly or has done in the past, it can, like with patient involvement, for example, on that subject, it can always feel a little bit like preaching to the converted. You know, like you will go in a lecture that's talking about the importance of lived experience, and it's either sparsely populated or everyone there is already a big proponent of that and a big spokesperson for that. So I suppose the bit I'm getting to in terms of a question is, how can people like me or people watching this, listening to this, etc., help the cause, help the mission? Is there anything we can do in terms of health literacy to raise awareness of it, or maybe draw people's attention to the importance of it?
Yeah, so actually, I was writing an article about this just last night, and the way I started the article was by saying, you know, have you ever been prescribed a medication? Have you ever been, you know, have you been asked if you want to receive a vaccine? And did you understand all the information that was given to you? If not, you weren't alone. And I think that's the crux of it. So I think at the most basic level, just asking and having the confidence to ask. I know that's a big ask for a lot of people, but having the confidence, first of all, to open up that conversation with your clinician. It should be opened up by them, to be honest. But if it doesn't come, asking them, actually, can you explain that to me in a different way? I didn't quite get that. Because it, you know, then it will actually open the eyes of the person in front of you to be like, oh, actually, I wonder how many people today also didn't understand or need it to be sort of explained in a slightly different way. So I think that's probably the first thing on a very individual level. I think more broadly, sorry, I need to ask you what the question was again, actually.
In terms of, like, if people like who are just watching this in the audience, or people like myself want to get involved or raise awareness or help with them.
Yeah, absolutely. So yeah, that's on the individual level. Then there is also the Health Information Week that happens every year as well, which if anybody's on social media, that's a great way to like share content, share awareness, and that will have wide-reaching effects just to raise awareness about the importance of clear health information rather than health literacy itself. In terms of patients getting involved in research, EULAR's doing a lot of work in this area. So like the updated guidelines on a more formal front came out last year on patient involvement in research and patient research partners. And I think that's really made quite a difference from what I can see in the sort of research side of things for people who didn't quite weren't aware of patient and public involvement is getting more and more of being highlighted, but certainly that's really helped on that front. People can also get involved with EULAR from the PARE perspective as well. They're always looking for volunteers. And I think from the health literacy perspective specifically, yeah, as I say, it's really a case of opening up the conversations, which I will say again, should really be, it's a collaborative approach and a shared decision-making thing. But just saying that, actually, look, is there any other form in which this information is received? Or if you can't access the internet, say, for example, for a remote consultation, just calling and saying, look, actually, could it be a telephone or a face-to-face instead, and explaining why. I think we've still got a way to go before health literacy is sort of embedded directly within our care systems. But that's really where I would be starting.
It's having, you said confidence, and it's having that confidence to ask why, isn't it? And I think because a lot of us who, we've got a lot of people who watch this from, who've got autoimmune diseases like myself and stuff, and they're a lifelong thing, or they tend to be, they're not going away once you're diagnosed. And I think sometimes it can be a really hard thing to ask, because the assumption is you should know. And I don't think we should ever be embarrassed about, and I totally I know what that's like. I've had the same rheumatologist since I was 12 years old, and he's a wonderful man, but that thought of saying, why are we doing this again? Or what, why does this cause me to have lots of infections? It can feel like, I don't know, because you want to be part of the conversation, but you also don't want to be like an anchor sort of thing around someone's leg, or I can't think of a better explanation, but you know what I mean? So that is a difficult conversation. So I suppose the only thing I would add to that is take that caregiver with you, take an advocate, take somebody who maybe can
Yeah.
give a different approach, right? And ask that maybe that question for you.
It just goes back to what I was saying before, that, like, you know, particularly having the caregiver with you, or a member of family or whoever it is, that makes a real difference. And I think also reassures the person, that the clinician or the healthcare professional in front of you, that actually, yeah, there's two people listening. Like, it's more likely that hopefully something will be remembered. But also, yeah, I think the confidence is the key thing, and just remembering that actually the healthcare professional probably thank you for it, that, oh, actually, yeah, I didn't realize that you didn't understand this, or you wanted the information in a different way. And I think, yeah, it's as I say, it's a collaborative approach to care. It's not a one-way conversation.
Yeah, and there is hope in that. I was involved in one project, but I'm seeing more and more projects as well where information sheets are double-sided. And if no one's thought of doing this, feel free to take this idea and run with it if you're watching. Where you have the fact sheet on one side for the health professional and the fact sheet on the other side for the patient.
That's
or the
an
person involved.
yeah.
Because you can literally take that, and I've done it myself. You can take it to an appointment, and you can read the bits that give you the prompts of what you might want to ask, but on the back is for the medical professional, and at the very least you can leave it with them, you know, so say that conversation doesn't happen, time runs out, whatever, you can leave it with them, and then maybe them questions get asked the next person that comes in, or whatever. So it's kind of like that holistic, someone's mentioned it in chat, that holistic approach where we're all basically on the same team, and we've got to try and elevate the importance of it, right?
Absolutely. Yeah.
Brilliant. I'm conscious of your time, and it is a Sunday. So is there anything we haven't covered that you wanted to get across or mention or talk about in regards to this subject?
I think, yeah, we've covered a lot of ground, I think. I just hope it was all useful, even if it's just the, you know, where to find good health information. That would be a good start. And hopefully it's of use to somebody out there.
Oh, more than useful. I mean, I cannot tell you how perfectly this aligns with why we do all of this. You know, the whole point of us starting this was like, right, well, I've got this condition, I know how it affects me, but that means nothing. And as an advocate, that's one experience. That doesn't make me a very informed advocate. So the whole point was getting people to share their experiences so we can have our finger on the pulse and use that to do good work. So having somebody like you to come in and explain, you know, these issues that matters to us, but we don't maybe understand where they fit or what power we might have in terms of asking those questions or getting involved is so important. And I know for a fact it would have definitely helped somebody. And you speak beautifully, so thank you so much for and for asking. I should point out, like, there's no pre-prepared questions here. Sometimes professionals, clinicians, academics can be a bit uncomfortable about just coming on and chatting on a Sunday night, but the fact that you reached out and asked to come, I think says a lot about you and the amazing work you're doing. And all I'd say is just don't forget us. You're clearly going to go on and do amazing things. You are already doing so much. So yeah, come back.
Absolutely won't forget the experience. So thank you. Thanks very much for having me.
Brilliant. Thank you so much for joining us. Enjoy the rest of your weekend, and we'll speak soon.
Thank you.
Bye-bye. Oh, that's why we do this, guys. That's why we do this. Let me bring chat back up on screen. I hope you enjoyed that. There we go. We're back. Thank you for everyone's contributions tonight in chat. I featured a couple of them. I read them all. It's exactly why we're here, though, right? You know, that is, and for all the people that have come before as well. There's lots of people that spring to mind. I was thinking to start naming, but no, we'll do it. So you know, people like Dr. Yildiz Pryor, Matthias Augustin, Rachel Sommer, all those people, like international clinicians, people from different backgrounds that have asked to come on the show to lend their experience, their voice, their angle from the other side of the table. And you combine that with your lived experience, as somebody like Amy's been on the show, I see in chat, Barry's been on the show, you know, all your experiences together. That's bloody powerful, you know. And I'm so proud of this. It's the scariest part of my week. I know I've said this a lot. It's the scariest part of my week. I probably let it ruin far too many of my Sundays worrying about how it's going to go, or if I'm fine as a host, but genuinely conversations like that tonight is exactly what I envisaged when we started all this and why I put myself through that. So yeah, thank you so much for all the people that have offered. If you want to come on the show, please do get in touch. basically we're fairly relaxed, you know, as long as you are not trying to sell anything and you want to talk about your lived experience, you run a patient organization, you're an academic or researcher in the general area of chronic illness. We're not limited to pain anymore. We've far outgrown that. I probably should have thought about that and had loftier ambitions when I named it, but it's staying now. Or, you know, you are doing advocacy or work in that space to change or improve patient outcomes, just like we're talking about tonight. If you tick any of those boxes, I'm open to hearing from you. Like, you know, that's what we're here for. That was absolutely fabulous. That was brilliant. Tracy, thank you so much. I must have subconsciously just read your message because I used the word fabulous and you've said fabulous. So thank you so much for watching. All the people that are watching over on LinkedIn, I hope you enjoyed it. If you want to get involved, please do. Guys, if you haven't done so already, remember you can go back. There's 2 ways you can watch this, or 3 technically. You can go back on our YouTube channel, Joel vs Arthritis, where you can see all the interviews. It chops off all of my rambling at the start and the end, and you can just see the interviews. And I've tried to categorize those into subjects, so we've got like skin conditions, arthritis, mental health, etc. And if you see a gap, it's not intentional. We want to fill it. So if you see we've not covered X, Y, and Z, get in touch, because I really want that to be a library of experiences. For example, we touched upon it in some episodes, but we've not had a direct one on things like autism and ADHD, Asperger's, all them, you know, that group of conditions. We've not had specific sort of episodes on. That'd be great to tick that off. We've not had a cancer one, which feels like a big blind spot. So if you are a cancer advocate, cancer survivor, work for an organization, you know, that feels like a subject we should cover. HIV is another one. So there's lots. We've got lots of work to do. Which work will never end. But if you see a gap on our YouTube in terms of buckets of lived experiences, it's not by design. It's not because we're limited to skin conditions and mental health. It's because we haven't got around to them yet. So please do get in touch. And you can also watch the reruns, which are by far the most popular, which is weird because you get all of this nonsense at the start and the end of the interviews, but so many people watch the rerun. So what happens if you're just dropping in late, when I end the stream in a moment, you'll be able to see instantly on LinkedIn, YouTube, Facebook. I would recommend YouTube. It supports us more, because the more eyeballs over there means the more people that finds us, but also it's a better viewing experience. But yeah, on YouTube, the minute we end the stream, you can watch the whole thing start to finish, and all the other interviews start to finish, warts and all. If I completely butcher an intro, you get to see it and laugh at my expense. That's fine. So yeah, go check those out. And there's also lots of clips and advocacy bits and pieces. I'm trying to do a bit more vlogging as well, because lots of people have asked me to do more when I go on the trips and stuff. I'm not very comfortable with it. But Dylan, my 6-year-old, did convince me to buy a little gimbal for my phone because he said the videos were too wobbly, in his words. So we're trying to level up. And when I go to Prague in a couple of weeks for the Global Skin Conference, maybe I'll take that with me. And speaking of conferences, guys, because I've had a couple of you ask, as yet, I'm not at EULAR because I haven't found a way of funding it. Again, there's no way, you know, for me to go to one of these conferences, you're looking at about £1,000 by the time you book tickets, and hotels. Like EADV is the worst, and places where there is no discounted patient or advocacy price. And don't get me started on that. EULAR is very, very generous and very supportive of patients, and I've always been very grateful of them in the past. But the minute I've not found a project, I'm not recording there this year like we did last year and the year before and everything. So if you can help with that, or you want me there, why would you? But yeah, this is my only and last request. But if that changes, guys, I'll let you know, because I know lots of people enjoyed that podcast series we done last year. But I will be at the Global Skin Conference. And there is some other things coming up. I can't announce one of them yet because I only got the email on Friday. But there will be more content coming out from me regarding international organisations. And also, because I have to, it's my job as chair of Rheumatic Disease UK, obviously this very community, it still makes me well up when I say that. This very community, I would normally list them, but some of them are in chat. Nia, Cine, Snuffles, another one in chat, plus others. founded Rheumatic Disease UK last August because of this peer support community. Like, how amazing is that? That we were doing this and we saw a need. We took the idea to EULA last year. Lots of people supported us. A massive thank you to all the people that supported us. You know who you are. We launched in August, and we are doing things that I never thought we would do in year one. We're not even close to a year old. So if you want to get involved with that, then get in touch with me, or check out the website soar.org. Is it .org? Jesus Christ, it's a Sunday, all right? It's a Sunday. I know. I should not doubt my own organisation's website, psor.org. Go check that out. And if you want to get involved, we've got Discords and everything, and we've got YouTube and podcast stuff to come. But for now, I want to make sure that that's working very much independently to what we do over here. So we will do all, our own content at some point, but I don't want to blur any lines. So guys, thank you for all the love and support. It's amazing what we've achieved together. I'm super excited about the year ahead. Remember, I won't be back this month in terms of this live stream format. We'll be back with ASIF or ASIF for World AS Day early May, which I'm super excited about. Look forward to talking about that in early May, and we've got lots of guests lined up in May as well. We've got a full calendar in May, but if you want to get involved, June, July, there's a little bit of room in June, but July, August, or taking bookings for the summer, get involved, share your experiences, and yeah, it'd be great to have you on. Guys, until next time, thank you so much for hanging out with me. Thank you for tolerating me being a bit under the weather. I generally 10 minutes before I went live didn't think I was going to make this. Sorry if I've looked a bit beetrooty tonight, and enjoy. At the very least, guys, I hope I stopped you thinking about Monday for an hour, which I've never reminded you about. I know, I'm sorry, but that's what we exist for. Escapism, distraction, raising awareness, reducing stigma. Thank you for being a part of it, and I'll see you very soon. Bye-bye.